Baking soda is more than just a kitchen staple. It's a powerful natural remedy with incredible health benefits. Used for centuries, this simple yet potent compound has been praised for its ability to neutralize acid, support digestion, and reduce inflammation. But did you know that baking soda can also soothe skin irritation, promote oral hygiene, and even aid in kidney health? Many overlook its potential, yet when used correctly, it can be a game changer in everyday wellness. From relieving heartburn to combating bad breath, its versatility is truly remarkable. However, as with any remedy, proper usage is key to unlocking its full potential while avoiding unwanted side effects. Stay with us as we uncover the science-backed benefits and expert-approved ways to incorporate baking soda into your health routine safely and effectively. Baking soda, also known as sodium bicarbonate, is an alkaline compound widely recognized for its therapeutic properties. Its chemical nature allows it to neutralize acids, making it a valuable remedy for a variety of health conditions. While often associated with household cleaning or baking, its medicinal applications have been utilized for centuries, offering benefits ranging from digestive relief to skin protection and kidney support. However, its use must be carefully regulated, as excessive consumption can lead to adverse effects such as electrolyte imbalance. One of the primary benefits of baking soda is its ability to neutralize acid. This makes it particularly useful in managing conditions related to excessive acidity, such as heartburn and acid reflux. Gastric acid plays a crucial role in digestion, breaking down food and killing harmful bacteria, but an overproduction can lead to discomfort and damage to the esophageal lining. When consumed in moderation, baking soda can act as an antacid, temporarily alleviating symptoms of acid reflux by neutralizing stomach acid. For example, individuals suffering from gastroesophageal reflux disease (GERD) often experience chronic heartburn due to weakened lower esophageal sphincters, which allows stomach acid to flow back into the esophagus. Drinking a mixture of baking soda and water may provide short-term relief, though it should not be relied upon as a long-term solution. Excessive use can disrupt the body's natural acid-base balance, leading to metabolic alkalosis, a condition characterized by nausea, muscle twitching, and confusion. Beyond digestive health, baking soda plays a significant role in reducing inflammation. Inflammation is the body's natural response to injury or infection, but chronic inflammation can contribute to various diseases, including arthritis and cardiovascular conditions. Studies suggest that baking soda has anti-inflammatory properties that help modulate immune system activity. For instance, research conducted at Augusta University found that regular consumption of baking soda encouraged the spleen to produce more regulatory immune cells, which help control excessive inflammatory responses. This is particularly beneficial for individuals with autoimmune disorders, such as rheumatoid arthritis, where the immune system mistakenly attacks healthy tissues, leading to joint pain and swelling. By influencing immune cell behavior, baking soda may offer a simple yet effective means of managing inflammatory conditions. However, clinical applications require further study to determine appropriate dosages and long-term safety. Another crucial application of baking soda is its impact on kidney health. The kidneys are responsible for filtering waste from the bloodstream and maintaining electrolyte balance, but individuals with chronic kidney disease, CKD, often struggle with maintaining proper pH levels due to reduced kidney function. Metabolic acidosis, a condition commonly seen in CKD patients, occurs when the body accumulates too much acid, leading to symptoms such as fatigue, shortness of breath, and confusion. Research suggests that bicarbonate supplementation may help slow the progression of CKD by reducing acid buildup in the blood. A clinical trial published in the Journal of the American Society of Nephrology found that CKD patients who took sodium bicarbonate supplements experienced a slower decline in kidney function compared to those who did not. This highlights baking soda's potential as a therapeutic intervention for kidney health. However, patients should only use it under medical supervision, as improper dosage can lead to complications such as hypertension and fluid retention. Baking soda is also widely used in dermatology for its skin-soothing properties. Its mild alkalinity makes it an effective remedy for conditions such as eczema, psoriasis, and insect bites. The skin has a naturally acidic pH, which acts as a protective barrier against bacteria and environmental irritants. However, conditions like eczema are often associated with an overly acidic skin environment, leading to irritation and itching. A baking soda bath can help neutralize excessive acidity and provide relief from itching and discomfort. Additionally, its mild antiseptic properties can help prevent bacterial infections in minor wounds or skin abrasions. For instance, applying a paste made from baking soda and water to a bug bite may reduce swelling and itching by counteracting the acidic compounds injected by the insect. Despite these benefits, excessive or prolonged use of baking soda on the skin can lead to dryness and disruption of the natural skin barrier, emphasizing the need for moderation. In addition to its dermatological benefits, baking soda plays a role in oral health maintenance. The mouth is home to a diverse microbiome, with both beneficial and harmful bacteria coexisting. Poor oral hygiene can lead to bacterial overgrowth, resulting in bad breath, gum disease, and cavities. Baking soda has natural antibacterial properties that help control bacterial populations in the mouth, making it a common ingredient in toothpaste and mouth rinses. Its ability to neutralize acids is particularly beneficial in preventing enamel erosion caused by acidic foods and beverages. Studies have shown that baking soda-based toothpaste is more effective at removing plaque compared to standard non-baking soda formulas. Additionally, a baking soda mouth rinse can help reduce oral ulcers by creating an environment that discourages bacterial proliferation. However, due to its abrasiveness, direct and frequent application on teeth should be avoided to prevent enamel wear. While the benefits of baking soda are well documented, its usage must be approached with caution. Overconsumption or excessive topical application can lead to unintended side effects. One of the primary risks associated with ingesting large amounts of baking soda is electrolyte imbalance. Sodium bicarbonate, when metabolized, contributes to an increase in sodium levels, which can lead to high blood pressure, fluid retention, and even heart complications. Individuals with hypertension, cardiovascular disease, or kidney conditions should consult a healthcare provider before using baking soda as a remedy. Another risk is alkalosis, a condition where the blood becomes too alkaline, resulting in symptoms such as vomiting, muscle tremors, and altered mental status. Alkalosis can be particularly dangerous in individuals with pre-existing health conditions, as it disrupts normal physiological processes, including oxygen delivery and muscle function. In clinical settings, baking soda is sometimes used as an emergency treatment for certain medical conditions. For example, in cases of acute metabolic acidosis, intravenous sodium bicarbonate is administered to rapidly correct blood pH levels. It is also used in cases of aspirin overdose, where it helps alkalinize urine and enhance the elimination of salicylates from the body. These applications highlight the medical importance of baking soda, though they require precise dosing and medical supervision to ensure safety. Despite its remarkable versatility, baking soda should not be seen as a cure-all solution. It can complement conventional treatments, but it should not replace medical therapies prescribed by healthcare professionals. Proper education on its benefits and risks is essential for safe usage. The potential benefits of baking soda, ranging from digestive support to anti-inflammatory effects, skin relief, kidney protection, and oral health improvements, demonstrate its value as a natural remedy. However, as with any supplement or alternative treatment, it is crucial to use it responsibly and seek professional guidance when necessary. With mindful application, baking soda can serve as a beneficial component of a holistic health regimen, providing relief and support for various conditions while minimizing risks. Baking soda, or sodium bicarbonate, has been widely recognized for its medicinal properties, particularly in its role in alleviating mouth ulcers and reducing arthritis-related inflammation. As a seasoned medical professional, I will dissect the biochemical mechanisms, physiological responses, and potential implications of these uses, offering a nuanced understanding of its effects on the human body. Mouth ulcers, commonly known as canker sores, are painful lesions that develop on the mucous membranes of the oral cavity. They often result from trauma, nutritional deficiencies, hormonal fluctuations, or autoimmune responses. The acidic environment of the mouth exacerbates the discomfort and prolongs the healing process. Sodium bicarbonate, being an alkaline compound, effectively neutralizes oral acidity, creating a more favorable environment for healing. The pain relief mechanism primarily stems from the buffering effect of baking soda, which reduces the irritation caused by acidic foods and drinks. Moreover, it possesses mild antiseptic properties that inhibit bacterial proliferation, reducing the risk of secondary infections that could complicate the healing of oral lesions. When mixed with water and used as a mouth rinse, baking soda acts as a mild astringent, helping to dry out ulcerative lesions and accelerate epithelial regeneration. The alkaline environment it creates can prevent further tissue breakdown and support cellular repair. This is particularly beneficial for individuals with recurrent aphthous stomatitis, a condition characterized by frequent outbreaks of painful mouth ulcers. Furthermore, sodium bicarbonate disrupts biofilm formation in the oral cavity, impeding the adhesion of pathogenic bacteria such as Streptococcus mutans and Porphyromonas gingivalis, which are implicated in various oral diseases. By reducing bacterial load and minimizing the accumulation of irritants, baking soda indirectly contributes to the rapid resolution of mucosal inflammation. In addition to its direct antiseptic effects, sodium bicarbonate modulates inflammatory pathways within the oral tissues. Its ability to stabilize pH levels mitigates excessive immune activation, thereby preventing the exaggerated inflammatory responses that can prolong ulcer healing. The osmotic effect of baking soda also facilitates fluid movement out of inflamed tissues, reducing edema and discomfort. For patients suffering from oral ulcers associated with conditions like Behçet's disease or inflammatory bowel disease, where systemic inflammation contributes to mucosal ulceration, sodium bicarbonate serves as an adjunctive therapy to conventional treatments, helping to control localized inflammatory damage. Shifting focus to arthritis, a chronic inflammatory disorder affecting the joints, sodium bicarbonate has garnered attention for its potential in modulating immune responses and mitigating joint inflammation. Arthritis, particularly rheumatoid arthritis, is characterized by an aberrant immune response in which the body's defense mechanisms mistakenly attack synovial tissues, leading to persistent inflammation, pain, and joint destruction. The inflammatory cascade in arthritis involves the activation of pro-inflammatory cytokines such as tumor necrosis factor alpha (TNF-alpha), interleukin-1 beta (IL-1 beta), and interleukin-6 (IL-6), which perpetuate tissue damage and exacerbate disease progression. Recent studies have suggested that sodium bicarbonate influences immune cell behavior, shifting the balance from a pro-inflammatory state to an anti-inflammatory one. One proposed mechanism is its effect on macrophages, the key immune cells involved in the inflammatory process. Under inflammatory conditions, macrophages adopt an M1 phenotype, which promotes tissue destruction through the release of inflammatory mediators. However, in the presence of sodium bicarbonate, macrophages transition to the M2 phenotype, which is associated with tissue repair and anti-inflammatory effects. This phenotypic shift dampens excessive immune activation, thereby reducing synovial inflammation and joint damage. Moreover, the alkalinizing effect of sodium bicarbonate plays a crucial role in regulating systemic inflammation. Chronic acidosis, a condition where the body maintains a slightly acidic pH due to metabolic processes, has been linked to increased inflammatory activity. By counteracting acidosis, sodium bicarbonate helps restore physiological pH balance, which can have a downstream effect on reducing inflammatory signaling pathways. This mechanism is particularly relevant for patients with metabolic disorders or dietary patterns that contribute to systemic acidity, exacerbating inflammatory conditions like arthritis. In addition to its immunomodulatory effects, sodium bicarbonate supports renal function, which indirectly influences inflammation control. The kidneys regulate acid-base balance by excreting hydrogen ions and reabsorbing bicarbonate. In patients with arthritis, impaired renal function or chronic inflammation can disrupt this balance, leading to metabolic acidosis and further exacerbating joint pain. By supplementing with sodium bicarbonate, individuals can aid their kidneys in maintaining optimal pH levels, thereby reducing systemic inflammation and improving overall joint health. When consumed in appropriate doses, sodium bicarbonate serves as an adjuvant therapy for arthritis by reducing oxidative stress within joint tissues. Oxidative stress, driven by an imbalance between reactive oxygen species, ROS, and the body's antioxidant defenses, contributes to cartilage degradation and synovial inflammation. Sodium bicarbonate's ability to enhance cellular buffering capacity helps mitigate oxidative damage, preserving joint integrity and function. This is particularly beneficial for osteoarthritis patients, where cartilage erosion is a primary concern. Additionally, sodium bicarbonate's effect on pain perception in arthritis should not be overlooked. Inflammatory pain arises due to the sensitization of nociceptors, the sensory neurons responsible for transmitting pain signals. Acidic conditions within inflamed joints heighten nociceptor sensitivity, amplifying pain responses. By neutralizing excess acidity, sodium bicarbonate can attenuate nociceptor activation, leading to a reduction in perceived pain intensity. This mechanism may explain anecdotal reports of arthritis patients experiencing symptomatic relief upon consuming baking soda solutions. However, while sodium bicarbonate offers potential therapeutic benefits for mouth ulcers and arthritis, it is imperative to use it judiciously. Overuse can lead to electrolyte imbalances, particularly in individuals with compromised kidney function or hypertension. Excessive bicarbonate intake may disrupt sodium and potassium homeostasis, leading to complications such as fluid retention, high blood pressure, and metabolic alkalosis. Thus, medical supervision is recommended, especially for patients with pre-existing health conditions. In conclusion, sodium bicarbonate exhibits promising therapeutic properties for oral ulcers and arthritis-related inflammation. Its ability to neutralize acidity, modulate immune responses, and alleviate oxidative stress underscores its potential as a complementary treatment strategy. While further clinical research is warranted to elucidate its long-term effects and optimal dosing regimens, its accessibility and affordability make it an attractive option for individuals seeking natural remedies for inflammatory conditions. As with any therapeutic intervention, a balanced approach is necessary to harness its benefits while minimizing potential risks. Baking soda, also known as sodium bicarbonate, has long been recognized for its remarkable ability to neutralize excess stomach acid and alleviate the discomfort associated with acid reflux and heartburn. When consumed, sodium bicarbonate acts as a powerful antacid, effectively counteracting the acidic environment within the stomach. This is crucial for individuals suffering from gastroesophageal reflux disease (GERD), a condition characterized by the backflow of stomach acid into the esophagus, leading to burning sensations in the chest, regurgitation, and even chronic irritation of the esophageal lining. The mechanism behind baking soda's efficacy in relieving heartburn lies in its alkaline nature. The stomach naturally produces hydrochloric acid, HCl, to facilitate digestion, but excessive acid production or weakened lower esophageal sphincter function can allow acid to escape into the esophagus, causing irritation. When baking soda is ingested and mixed with stomach acid, it triggers a chemical reaction that produces carbon dioxide, water, and sodium chloride. This reaction raises the pH of the stomach contents, reducing acidity and alleviating the burning sensation associated with acid reflux. The immediate relief provided by this reaction makes baking soda a valuable short-term remedy for those experiencing occasional heartburn. However, while baking soda is effective in neutralizing acid, its frequent or excessive use can lead to potential complications. Since sodium bicarbonate generates carbon dioxide upon reacting with stomach acid, some individuals may experience bloating or increased belching. This buildup of gas can cause temporary discomfort. Additionally, because baking soda contains sodium, individuals with high blood pressure, kidney disease, or heart conditions should exercise caution when using it as a remedy. Sodium retention can lead to fluid imbalances, increasing blood pressure and straining the cardiovascular system. Despite these concerns, baking soda remains a safe and effective remedy for acute episodes of heartburn when used in moderation. The recommended dosage is typically 1 teaspoon of baking soda dissolved in a glass of water, taken slowly to prevent excessive gas buildup. In cases of persistent acid reflux, individuals should consult a healthcare professional to determine whether they require a more long-term therapeutic approach. Beyond its benefits for digestive health, baking soda is also widely utilized in skincare, particularly for its ability to hydrate dry skin and provide gentle exfoliation. The outermost layer of the skin, known as the stratum corneum, is responsible for retaining moisture and protecting against environmental stressors. However, factors such as cold weather, low humidity, and frequent exposure to harsh soaps can strip the skin of its natural oils, leading to dryness, irritation, and flaking. Baking soda, when combined with water or nourishing ingredients like coconut oil, can serve as an effective remedy for restoring skin hydration and promoting a smoother complexion. The alkaline nature of baking soda allows it to balance the skin's pH, which can be beneficial in cases of excessive dryness. The skin typically maintains a slightly acidic pH to support its barrier function and microbial balance. However, when this balance is disrupted, it can lead to increased sensitivity, redness, and susceptibility to irritation. By providing a mild alkalizing effect, baking soda can temporarily soothe inflamed or itchy skin, making it a popular choice for individuals suffering from conditions such as eczema or psoriasis. In addition to hydration, baking soda possesses natural exfoliating properties that can help remove dead skin cells, revealing a brighter and more even complexion. Regular exfoliation is essential for maintaining healthy skin, as the accumulation of dead cells can contribute to dullness, clogged pores, and uneven texture. When used as a gentle scrub, baking soda helps slew away these surface impurities without causing excessive abrasion or irritation. This makes it a suitable option for individuals with sensitive skin who may not tolerate harsher exfoliants such as glycolic acid or microbeads. To use baking soda for exfoliation, it can be mixed with water to form a paste and gently massaged onto the skin in circular motions before rinsing with warm water. For enhanced hydration, incorporating coconut oil into the mixture can provide additional nourishment, as coconut oil contains essential fatty acids that help replenish the skin's lipid barrier. This combination is particularly effective for areas prone to dryness, such as elbows, knees, and heels. While baking soda is a versatile and cost-effective skincare remedy, it is important to use it in moderation to avoid potential side effects. Prolonged or excessive use of baking soda on the skin can disrupt the natural acid mantle, leading to increased sensitivity and vulnerability to environmental stressors. Individuals with highly sensitive or reactive skin should perform a patch test before applying baking soda-based treatments to larger areas. Overall, baking soda serves as an invaluable tool for addressing both digestive discomfort and skincare concerns. Its ability to neutralize stomach acid provides relief from heartburn, while its hydrating and exfoliating properties support skin health. By understanding the proper usage and limitations of baking soda, individuals can harness its benefits safely and effectively, ensuring both internal and external well-being. Halitosis, commonly referred to as bad breath, is a widespread oral health concern that affects millions of individuals globally. While numerous factors contribute to this condition, including poor oral hygiene, dietary habits, and underlying medical conditions, one effective and natural remedy that has gained significant recognition is baking soda. This simple compound, scientifically known as sodium bicarbonate, offers a powerful solution to combat bad breath through its ability to balance oral pH levels and neutralize bacteria responsible for foul odors. One of the most critical factors in oral hygiene is the maintenance of an optimal pH level within the mouth. The human mouth naturally harbors bacteria, both beneficial and harmful, and an acidic environment can encourage the overgrowth of odor-producing bacteria. Many foods and beverages, such as coffee, citrus fruits, and sugary treats, contribute to increased acidity, creating a breeding ground for anaerobic bacteria that thrive in low oxygen conditions and produce volatile sulfur compounds, VSCs. These sulfur compounds, including hydrogen sulfide and methyl mercaptan, are directly responsible for the characteristic foul smell associated with halitosis. Baking soda acts as a mild alkaline substance that neutralizes excess acidity, creating a more balanced environment that discourages bacterial proliferation. Regular rinsing with a baking soda solution can restore the mouth's natural pH, reducing the likelihood of persistent bad breath. In addition to pH regulation, baking soda exhibits potent antibacterial properties that make it an effective agent against oral malodor. Unlike conventional mouthwashes that may contain alcohol and harsh chemicals, baking soda provides a gentler yet highly effective alternative. Research has demonstrated that sodium bicarbonate can disrupt bacterial biofilms, which are structured communities of bacteria adhering to surfaces within the mouth, such as the tongue, gums, and teeth. By breaking down these biofilms, baking soda prevents bacteria from accumulating and producing VSCs, thus reducing halitosis at its source. Furthermore, its ability to penetrate deeper into crevices of the oral cavity ensures a more thorough cleansing effect than many commercial mouthwashes. Another significant advantage of using baking soda as a remedy for bad breath is its ability to absorb and neutralize odors rather than merely masking them. Many commercially available breath fresheners rely on strong fragrances to cover up bad breath temporarily, but they do not address the root cause of the issue. In contrast, sodium bicarbonate chemically interacts with acidic and sulfuric compounds, rendering them inert and eliminating their foul-smelling properties. This makes baking soda an excellent choice for individuals seeking a long-lasting and natural solution for oral malodor. Saliva production plays a crucial role in maintaining oral health and preventing bad breath. A dry mouth, also known as xerostomia, can exacerbate halitosis by allowing bacteria to thrive in the absence of adequate saliva flow. Saliva helps wash away food particles, neutralize acids, and control bacterial populations within the mouth. Individuals suffering from dry mouth due to medication use, dehydration, or medical conditions may find relief by using baking soda rinses, which can stimulate saliva production and restore moisture balance in the oral cavity. This not only alleviates bad breath but also promotes overall oral health by preventing tooth decay and gum disease, both of which are commonly associated with dry mouth conditions. The tongue serves as a major reservoir for bacteria responsible for halitosis. Its rough surface provides an ideal environment for bacterial accumulation and food debris retention. Regular tongue cleaning, in combination with a baking soda mouth rinse, can significantly reduce the bacterial load contributing to bad breath. Some individuals prefer to create a gentle baking soda paste by mixing the powder with a small amount of water and using it to scrub the tongue. This approach effectively dislodges bacteria and removes biofilm layers, leading to a fresher breath and a cleaner oral environment. For individuals suffering from chronic halitosis due to periodontal disease, baking soda can serve as a valuable adjunct to their oral care routine. Gum disease, caused by bacterial infections and inflammation of the gums, often leads to persistent bad breath. The antibacterial and anti-inflammatory properties of sodium bicarbonate can help reduce gum inflammation, minimize bacterial overgrowth, and promote healthier gum tissue. Rinsing with a baking soda solution can provide relief by neutralizing bacterial acids and soothing irritated gums, making it an effective complementary treatment for individuals undergoing periodontal therapy. A lesser-known benefit of baking soda in oral hygiene is its potential to improve the efficacy of toothpaste. Many toothpaste formulations include sodium bicarbonate as an active ingredient due to its mild abrasive properties and pH balancing effects. Its ability to remove plaque and surface stains without being overly harsh on tooth enamel makes it a preferred choice for individuals with sensitive teeth. Using a homemade baking soda rinse after brushing can enhance the cleaning process, ensuring that residual bacteria and food particles are effectively eliminated. While baking soda is a highly effective remedy for bad breath, it is essential to use it correctly to avoid potential drawbacks. Excessive use of baking soda can lead to an imbalance in oral flora or cause mild irritation to the soft tissues of the mouth. Therefore, it is recommended to use a diluted solution, typically consisting of 1 teaspoon of baking soda mixed with 8 ounces of water, for gentle and effective mouth rinsing. Individuals with specific medical conditions such as high blood pressure or kidney disease should consult a healthcare professional before using baking soda as an oral rinse, as excessive sodium intake may not be suitable for their health status. In addition to personal oral hygiene, baking soda rinses can be particularly beneficial for individuals who wear dentures or orthodontic appliances. These devices can harbor bacteria and food debris, contributing to persistent bad breath if not adequately cleaned. Soaking dentures in a baking soda solution overnight can help eliminate odors and maintain oral freshness. Similarly, individuals with braces can use baking soda rinses to reach areas that are difficult to clean with a toothbrush alone, reducing plaque buildup and minimizing the risk of halitosis. The effectiveness of baking soda in preventing bad breath is not limited to direct oral applications. Dietary habits also play a significant role in maintaining fresh breath, and incorporating baking soda into daily routines can contribute to a more balanced internal environment. Some individuals choose to drink a diluted baking soda solution to help regulate overall body pH and reduce acidity, which may indirectly benefit oral health. However, this practice should be approached with caution and under the guidance of a healthcare professional to ensure safe usage. In conclusion, the multifaceted benefits of baking soda in preventing bad breath make it an invaluable addition to oral hygiene practices. Through its pH balancing capabilities, antibacterial properties, odor neutralizing effects, and ability to support overall oral health, sodium bicarbonate offers a natural and effective solution for individuals seeking to combat halitosis. Whether used as a mouth rinse, tongue cleaner, or denture soak, baking soda provides long-lasting freshness without the need for artificial additives or harsh chemicals. By incorporating this simple yet powerful remedy into daily oral care, individuals can achieve a healthier and more confident smile while effectively addressing the root causes of bad breath. As a highly experienced physician, it is imperative to analyze the usage precautions of baking soda, particularly in individuals with pre-existing health conditions such as high blood pressure, kidney disease, or heart conditions. While baking soda is often praised for its natural and effective therapeutic properties, it is crucial to understand that its use must be properly regulated to prevent unintended health complications. This compound, known chemically as sodium bicarbonate, has a significant impact on bodily functions due to its alkaline nature. When consumed in excess or without proper guidance, it may disrupt the body's delicate balance, leading to potentially serious health consequences. One of the most concerning risks associated with excessive baking soda consumption is its effect on blood pressure. Baking soda contains sodium, which is a key component in table salt. While small amounts of sodium are necessary for maintaining normal physiological functions, an overabundance can contribute to hypertension. High sodium levels in the bloodstream cause water retention, increasing blood volume and subsequently raising blood pressure. This can place an increased burden on the heart, potentially leading to cardiovascular complications such as heart attacks or strokes in individuals who are already predisposed to hypertension. For this reason, those with high blood pressure should be particularly cautious when using baking soda as a remedy, ensuring that their sodium intake remains within recommended limits. Furthermore, individuals with kidney disease must be especially wary of baking soda consumption. The kidneys play a fundamental role in filtering excess substances from the blood, including sodium and bicarbonate. When kidney function is impaired, the body's ability to excrete these substances is compromised, leading to an accumulation that can disrupt normal biochemical balance. In cases of chronic kidney disease, this imbalance can worsen symptoms such as fluid retention, swelling, and metabolic acidosis. While some medical protocols incorporate baking soda as a therapeutic agent for slowing kidney disease progression by neutralizing acid buildup, it should only be administered under the supervision of a healthcare professional. Self-medication can result in worsening kidney function and other complications, making professional consultation essential. In addition to concerns regarding hypertension and kidney health, individuals with heart conditions should exercise caution when using baking soda. Excess sodium intake can contribute to fluid retention, leading to increased workload on the heart. This is particularly problematic for those with conditions such as congestive heart failure, where the heart's ability to pump blood efficiently is already compromised. Fluid overload can result in symptoms such as shortness of breath, swelling in the lower extremities, and exacerbation of heart failure symptoms. Given these risks, it is imperative for individuals with heart disease to consult a physician before incorporating baking soda into their regimen, ensuring that its use does not interfere with their cardiovascular health. Beyond the specific risks associated with pre-existing conditions, excessive consumption of baking soda can lead to a broader range of systemic issues. One such concern is the potential for electrolyte imbalances. Sodium bicarbonate influences the levels of key electrolytes such as potassium, calcium, and chloride, all of which are essential for normal cellular function. Disruptions in these electrolyte levels can manifest in symptoms such as muscle weakness, irregular heart rhythms, and neurological disturbances. In severe cases, a condition known as metabolic alkalosis may develop, characterized by elevated blood pH levels, nausea, confusion, and even respiratory difficulties. Metabolic alkalosis can be particularly dangerous in older adults and individuals with compromised organ function, necessitating strict regulation of baking soda intake. Another potential complication of baking soda overuse is its impact on digestive health. While it is commonly employed to alleviate acid reflux by neutralizing stomach acid, excessive use can paradoxically lead to a rebound effect, causing the stomach to produce even more acid once the initial neutralization occurs. This can exacerbate symptoms of gastroesophageal reflux disease, GERD, rather than alleviate them. Moreover, consuming large amounts of baking soda in a short period can lead to bloating, gas, and discomfort due to the release of carbon dioxide when it reacts with stomach acid. These digestive disturbances highlight the importance of using baking soda in moderation and only when truly necessary. Additionally, individuals taking certain medications should be mindful of potential interactions with baking soda. Due to its alkaline nature, sodium bicarbonate can alter the absorption and effectiveness of various drugs, including antibiotics, antifungal medications, and certain pain relievers. For instance, some antibiotics require an acidic environment for optimal absorption, and neutralizing stomach acid with baking soda may reduce their efficacy. Patients undergoing treatment for chronic conditions should discuss baking soda use with their healthcare provider to prevent any unintended interactions that could compromise the effectiveness of their prescribed medications. Aside from internal risks, external application of baking soda also requires careful consideration. While baking soda is often used as a natural exfoliant or remedy for skin irritation, prolonged or excessive use can disrupt the skin's natural barrier. The skin maintains a slightly acidic pH to protect against harmful bacteria and environmental irritants. Applying baking soda, which is highly alkaline, can strip away this protective layer, leading to dryness, increased sensitivity, and potential infections. Individuals with pre-existing skin conditions such as eczema or psoriasis should approach baking soda use cautiously, as it may exacerbate irritation rather than provide relief. It is also important to recognize that baking soda should not be considered a universal remedy for all ailments. While it possesses a range of therapeutic benefits, relying on it as a substitute for professional medical treatment can be dangerous. Self-diagnosing and self-medicating with baking soda, particularly in the absence of proper medical guidance, can mask underlying health conditions that require targeted treatment. For example, persistent acid reflux could indicate a more serious condition such as peptic ulcer disease or Barrett's esophagus, both of which require medical intervention beyond simple acid neutralization. Similarly, chronic bad breath may be a sign of an undiagnosed oral infection or systemic illness rather than just an issue of pH imbalance. Given the potential risks associated with improper use, it is essential to emphasize the importance of consulting a healthcare professional before using baking soda as a remedy, especially for individuals with pre-existing health concerns. Medical guidance ensures that its benefits can be harnessed safely while minimizing the likelihood of adverse effects. Physicians can provide personalized recommendations based on an individual's health profile, determining appropriate dosages and frequency of use. This approach is particularly crucial for individuals who are taking medications, have chronic conditions, or experience persistent symptoms that do not improve with self-care measures. Moreover, when using baking soda for therapeutic purposes, adherence to proper dosage is critical. While small amounts can be beneficial, exceeding recommended amounts can have detrimental effects. The body's natural regulatory mechanisms work to maintain a stable pH balance, and artificially altering this balance through excessive alkaline intake can lead to physiological disturbances. For this reason, individuals should always follow dosage guidelines provided by reputable medical sources or their healthcare provider. Over-the-counter baking soda products may contain instructions for safe use, and it is advisable to adhere to these recommendations to prevent complications. Ultimately, while baking soda is an accessible and cost-effective remedy with a range of applications, it must be used responsibly. Understanding the limitations and potential risks associated with its use is just as important as recognizing its benefits. Through informed decision-making and medical supervision, individuals can safely incorporate baking soda into their health routines without compromising their overall well-being. Proper education on this topic helps ensure that people do not fall into the trap of assuming that a natural remedy is inherently risk-free. By respecting dosage guidelines, being mindful of interactions, and seeking professional advice when necessary, the use of baking soda can remain a valuable addition to holistic health practices without endangering health outcomes.